Hi, I'm Dr. Christopher Bates, and I'm a plastic surgeon here at Ponte Vedra Plastic Surgery. And today I'm going to be talking about breast lift, or mastopexy as we call it. So a breast lift, or mastopexy, is a procedure in which we take the breast tissue of our patient and, for lack of better words, lift it up back to what we consider to be anatomically proportional to the patient that's coming in, basically just a more youthful breast. So a lot of patients that come in for mastopexy, they range in age, weight, status, a history of having children, kind of all the above. Some people, based on just genetics, have droopier breasts than others, and some just with time and genetics and gravity have lost some of the fullness of their breasts as well as had some droopiness of their breasts. So the breast lift in itself, there are different ways of doing it. It can be done in a fashion of just doing a circle around the nipple or the areola. We can convert that into a lollipop incision, it's called, or a vertical mastopexy, and where there's still an incision around the areola and then the scar that would go up and down from there. And then most commonly, we have to do what's called a wise pattern or an anchor type mastopexy, where we have the same incisions, the circle around the areola, the line straight up and down, and then under the curvature of the breast to form an anchor shape. And what this does is this helps reshape the entire breast mound and not just lift the nipple. Every patient is different, and some people need more lift of their nipples, some people need more reshaping of their breast. It really varies based on patient to patient. So that's why it's obviously very important to come in and get an evaluation before making your mind up what it is you need. Some of these patients actually do have a little bit of droop of their breast, but they're honestly more interested in fullness of their breast. And a lift alone can help somewhat with this, but truly a lot of the patients that are really wanting that fullness up top, they need an implant as well, and we'll get to that in just a second. So when I see my patients, I do measurements on their breasts, and based off these measurements, decide on what type of lift is appropriate for them. Go over, of course, the incisions, as well as what their postoperative expectations are, as well as the recovery period. So the surgery is a day surgery. You'd go home the same day. I typically do not use drains with my breast lifts, and again, they would go home the same day, and they're wearing a good supportive postoperative bra after the surgery. And depending on the type of incisions we place, there's different kind of upkeep with the breasts themselves. In the postoperative period, for the first 2 weeks, I ask my patients not to lift over 10 pounds. After 2 weeks, they can lift up to 20 pounds, and then slowly advance is tolerated after that, to where at about a month out, they're kind of free to fly. Back to the patients that are interested in more fullness in addition to the lift, they would a lot of the time benefit from what's called an augmentation mastopexy. So that's doing a combination of doing a implant as well as lifting on top of that. Now, there is a limit to how big of an implant we can do with this. Some people are really wanting to increase the size of their breasts, but these are opposing forces, meaning that the implant is increasing the size of the breast, but the mastopexy is not only lifting it, it's also cutting out extra skin to help reshape it. So you have two opposing forces, and at some point, there's a breaking point of what's too large to put in a breast before you have increased complication rates like wounds or incisions opening and things that we honestly don't like talking about, but they are known complications, and that's why we always want to advise our patients based on their anatomy and what their wishes are, what we believe to be best for them. To help with the breast lift, things that can be done are things like fat grafting. And fat grafting is where we actually do a little bit of liposuction on the body and take that fat and process it and then re-inject it into the breasts in the areas that are of most concern. A lot of women want more cleavage, or they do want some of that fullness up top, and we can actually recreate that by injecting fat into the breast and not actually having to use an implant. With fat grafting, I always tell my patients that I'm going to overdo it at first, because we know that not all the fat will stay. Usually only about 50 to 75% will stay. So we overdo it knowing that some will go away. With fat grafting as well, we tell them that it usually will take a couple, at least 2, maybe 3 rounds of fat grafting to achieve their full desired result. Again, there are many different ways of doing lifts. There are many different ways of augmenting the breast as well, and doing the two in conjunction with one another. So again, we always recommend that you come in for an evaluation, and we will do our best to recommend what we think is best for you and see how we can help out. If you're interested in liposuction, feel free to come see me or the other 4 partners here at Ponte Vedra Plastic Surgery. You can call us at 904-273-6200 or visit us online at pvps.com.